Sue, thanks for coming in to join us today on the Cancer Stories video programme. I'm interested to know at the beginning, how was your breast cancer revealed? What were the symptoms you were getting initially?
Initially I felt like something was catching on the underwiring of my bra, and it was just very slight. So I tried to say it was my imagination, although I did look in the bathroom mirror quite often, holding my arm up on the left side, which is where the cancer was, and on the right side, and convincing myself that they looked the same. But there was just a little bit of puckering. And one day I made an appointment to see my GP about something else, and just said, oh, by the way, I've got this, but it's probably my imagination.
So you were worried in the background, having seen that slight change?
I was, yes.
And did you have a delay? Because you know, when you worried, naturally we're caught in a bit of a catch-22. Do we go and get advice, in which case they might tell us something we don't want to know, or do we just hope it might go away? You know, did you have that gap?
I did have a gap, probably of about 6 months, because I was convinced myself it was my overactive imagination.
And did you notice a change during that time?
I didn't notice a change really, although I suppose it must have changed because I eventually went to the doctor, so it must have felt more significant than it had originally. Yeah. Otherwise I'd have carried on ignoring it.
So what advice did you get when you saw your GP?
He examined me and looked very shocked. As just said, my God, I don't believe that, I can't believe that, or something like that. And just looked horrified. Because we'd known one another for 20 years nearly, I think.
You had a good trust in your GP?
Yes, so he knew me well.
Yeah. So in a way, I mean, that reaction is extreme in a way, but...
It was very brief.
By the same token, you know he's taking it seriously at that point.
Yes, he looked very shocked, but he quickly recovered himself, so I think I knew then that something was wrong.
So what did he do? Did he refer you straight away?
He referred me straight away, and I was seen within 2 weeks.
That's the classic 2-week wait, isn't it?
Yes, that's right.
If they're worried about a cancer diagnosis, which we have in the UK. And what were the next step investigations? Did you have a biopsy, ultrasound? What was the...
I went to the breast care clinic and I had a mammogram, and I was sitting waiting, and all these other women kept coming in and going, except for me, and I was there for quite a long while. And I had a needle biopsy that morning, and I was examined, and then subsequently I had a scan, which is when they discovered I hadn't just got the tumour, but I'd got multifocal cancer on the other side. So I had another needle biopsy. And then they basically told me what I needed to have done. How long was that process altogether? It seemed to go on for quite a long time, but I don't think it did really. I seem to recall I first went in May, and I started chemotherapy in June, so it can't have been that long. How do you feel the whole process was handled by the clinicians there? The clinicians, very well, I think. There were 1 or 2 times when I think, well, one time that I can think of, when I think they were trying to, I don't know how to say it really. It was, burbling there. I think they were trying to be nice to me, and being nice, they didn't tell me the whole truth. And then I went along with a friend, which I thought was just a quick appointment, and it turned out not to be a quick appointment. And we were seen by one of the breast care nurses, and my friend said, we just want the truth. You should have told her that there was something else on the phone instead of saying everything was okay. And the nurse said, well, if you want to know the truth, she'll die if she doesn't have surgery, which I didn't think was a very good way of saying things. Whereas initially, what did they say to you? Which was slightly not the full truth. What did they say? Well, I had just the tumour that I knew about in my left breast. Then I had the scan, and I was told that I would only need to see the surgeon if something was wrong, and if there wasn't anything wrong, then I would just start my chemotherapy. And they rang me up and said, you need to see the surgeon. I said, does that mean it's spread? And they said, no. I said, does that mean there's anything else? And I asked them about 4 or 5 times. She said, no, there's nothing else at all. And at that point, I was kind of hoping I might be able to have a lumpectomy.
Okay.
But I told my friends and I told my aunts, and then I went along and it was, no, you need other things.
Unfortunately, what you were told then wasn't the whole story.
No.
And you feel they knew about it but didn't reveal it at that time. They didn't want to reveal it, if you like.
I think they were probably, looking back on it, caught in an awkward situation, and she probably shouldn't have said anything at all on the telephone, other than you need to come in.
Yeah. So you had then a treatment planning process for the further surgery, which for you was more extensive than you first anticipated.
Yes.
What surgery did you end up having altogether?
Well, I had my chemotherapy first, then I had a bilateral mastectomy.
And there's a question these days about reconstruction, isn't there? Whether reconstruction is offered and also whether it's wanted and when is it given. Sometimes it's offered immediately and given at the same time as the surgery, but often it's something that's discussed later.
It was something I asked about when they talked about the mastectomy, because right from the beginning I decided that I wanted to have reconstruction, but I couldn't have it immediately. I had the mastectomy because I needed to have radiotherapy. And you can't have, if you have the reconstruction, because I ended up having implants, it would affect those.
Yeah. So you had to have the chemotherapy and then the radiotherapy first?
I had chemotherapy, then mastectomy, then radiotherapy, then reconstructive surgery.